Baik, selamat siang kepada seluruh audiens, dokter spesialis THT, dan dokter Annabelle yang terhormat. Waktu yang kita nantikan telah tiba. Narasumber kita, Dr. Annabelle Wong, telah hadir bersama kita. Begitu pula Bapak Lias Rianto selaku Direktur PT Nusa Medika Indonesia yang telah hadir. Dan kami memohon izin kepada Dr. Annabelle dan Bapak Lias Rianto serta seluruh peserta yang hadir, kami akan memulai webinar pada siang hari ini. The moment we have been waiting for has arrived. Our speaker, Dr. Annabelle Wong, has joined us today along with Mr. Lias Rianto, the Director of PT Nusa Medika Indonesia. With the kind permission of Dr. Annabelle Wong, Mr. Lias Rianto, and also all distinguished participants present, we would like to officially begin this afternoon webinar.
Pergi ke taman membeli ketan.
Singgah sebentar di tepi kali.
Selamat datang para dokter yang cantik dan tampan.
Senang sekali dapat bertemu di webinar hari ini.
Selamat siang dan salam sehat untuk kita semua. Perkenalkan, saya Cynthia.
Dan saya Marcella.
Yang akan memandu jalannya webinar hari ini. Good afternoon, Dr. Annabelle. My name is Cynthia, and I'm here together with Miss Marcella. We will be your moderators for today's webinar session. Today's webinar will be conducted in both Indonesian and English to ensure smooth communication throughout the session. Thank you so much for joining us today, Doctor. We are truly honored to have you here with us.
Sebelumnya, izinkan kami memperkenalkan penyelenggara webinar pada siang hari ini, yaitu PT Nusa Medika Indonesia, perusahaan yang bergerak di bidang penyediaan alat kesehatan dan berkomitmen menghadirkan teknologi medis inovatif untuk mendukung pelayanan kesehatan di Indonesia. Pada kesempatan kali ini, kami juga menyampaikan salam hormat dan selamat datang kepada Bapak Lias Rianto selaku Direktur PT Nusa Medika Indonesia, yang berkenan hadir bersama kita pada webinar siang hari ini.
Rangkaian webinar hari ini meliputi sesi pemaparan materi, tanya jawab dan dokumentasi, kuis, serta penutupan. Untuk sesi tanya jawab akan berlangsung selama kurang lebih 20 menit, kemudian dilanjutkan dengan sesi kuis selama 5 menit. Dan untuk menjaga alur webinar tetap aman, pertanyaan dari peserta akan kami bantu kumpulkan terlebih dahulu sebelum disampaikan kepada narasumber. Doctor, after the presentation session, we will continue with a 20-minute Q&A session. Participants will submit their question through the chat box, and we will have collect and group the question before reading them to you one by one.
Selanjutnya, kami ingin menyampaikan beberapa aturan selama berjalannya acara agar suasana tetap kondusif tentunya. Yang pertama, dimohon untuk dokter untuk mikrofon dinonaktifkan selama sesi berlangsung. Yang kedua, dokter dipersilahkan menyalakan kamera agar pelaksanaan webinar lebih interaktif. Yang ketiga, pertanyaan dapat dituliskan melalui kolom chat selama sesi materi berlangsung. Dan yang terakhir, apabila memungkinkan, kami menghimbau dokter untuk menyiapkan 2 perangkat seperti handphone, laptop, atau tablet guna mengikuti Zoom webinar dan mengakses tautan kuis secara bersamaan.
Kami juga ingin menyampaikan beberapa penawaran menarik yang pastinya tersedia khusus bagi peserta webinar hari ini. Peserta berkesempatan memperoleh diskon 5% untuk pembelian pribadi seluruh produk, dengan pengecualian produk Inventis PT Nusa Medika Indonesia. Khusus untuk produk Inventis PT Nusa Medika Indonesia, peserta berhak mendapatkan diskon 10% untuk pembelian pribadi.
Nah, selain itu, tersedia referral fee atau support fee sebesar 10% bagi dokter maupun user yang mereferensikan atau mengajukan kebutuhan pengadaan alat ke rumah sakit.
Di akhir acara nanti juga akan diadakan sesi kuis. Peserta yang berpartisipasi berkesempatan memenangkan hadiah door prize berupa Remi Pro. Remi Pro adalah digital smart otoscope portable dengan dukungan AI yang memudahkan pemeriksaan telinga secara praktis dan modern. Alat ini terhubung langsung aplikasi smartphone untuk melihat, menyimpan, dan mendokumentasikan hasil pemeriksaan. Dilengkapi kamera HD dan light source, VEMP Pro memberikan visualisasi area telinga yang lebih jelas dalam desain yang kecil dan juga pastinya mudah dibawa kemana-mana. Alat ini berkorelasi dengan Brainstem Above Response Audiometry atau BERA karena keduanya sama-sama digunakan dalam evaluasi fungsi pendengaran. Dengan REMI Pro untuk pemeriksaan visual telinga dan BERA untuk penilaian respons saraf pendengaran secara objektif. Oleh karena itu, kami mengajak seluruh peserta untuk menghadiri webinar hingga selesai.
Baik, Cynthia. Untuk topik webinar hari ini tentunya sangat relevan dengan perkembangan dunia medis dan profesional saat ini nih, Sian, tentunya.
Nah, harapannya materi hari ini gak hanya menambah wawasan, tapi juga memberikan insight baru yang pastinya dapat diterapkan dalam praktek sehari-hari dokter.
Baik, tanpa berlama-lama lagi, berikut profil singkat narasumber webinar hari ini. Dr. Annabelle Wong adalah seorang tenaga medis yang sangat berpengalaman tentunya dengan keahlian luas di bidangnya, yaitu profesional di bidang audiologi. Kami sangat senang dapat menghadirkan beliau pada hari ini untuk berbagi pengetahuan dan pengalaman yang berharga kepada seluruh peserta.
Dr. Annabelle is a highly experienced medical professional with extensive expertise in her field, specifically in audiology. We are very pleased to have her here today to share her valuable knowledge and experience with all participants. Without further ado, Doctor, we would like to invite you to begin the presentation session. The time is yours.
Hello. Good to see you all here again. I'm going to share my screen and then we'll start the presentation. Maybe let's start. Okay, so very nice to see you guys and happy to have me here in the webinar. And I think because I'm not speaking Indonesian, maybe I say like a few sentences and then you translate, right?
Yes, doctor.
Mm-hmm. Okay, so I think I've been just now introduced through the Indonesian, and I'm the head of training in Southeast Asia for the Inventis equipment. And first of all, let's begin with some agenda, what we are talking about today. First of all, we are going to talk about some clinical foundations, some review, some very general review of the clinical foundation of what evoked potentials are. And then we are talking about the equipment, like what kind of equipment you're using and the licensing, what kind of license you'd like to have for different setup. Okay, so we talk about the modular architecture. And then we are going to talk about the system configuration, like what to go for together with the equipment so as to run the test smoothly. And then we are talking about the strengths of the current equipment, the Celesta, and we talk about some positioning of how we use in different setups, some key messages of the how to make use of the tests to go for the diagnosis, the assessment, and then finally some improvement, some intervention for our patients. Okay, and then we'll go through some very kind of more hardcore thing is the setup, initial setup and the connection. But don't worry, it's quite simple. And we talk about the Maestro software interface. Okay, so questions of interest. When we talk about, I talked to Mr. Lears and other of the as the stakeholders of today's webinar. We talk about for the Celesta system, what kind of patients you're helping eventually, because there are a lot of different Auditory Evoked potential tests and the Vestibular Evoked Myogenic potential tests. So what kind of patients we are helping? And then is the second, the clinical foundations. We talk about what we are really testing in human being. And then the third question of interest is the Celesta system configuration and what kind of license we available for choose. Okay, so let's move to the next part. So now for this webinar, our aim of the questions, what we really want to know is these three directions. Okay, so let's start with the clinical foundations of the evoked potentials. I think most of the participants here are doctors and audiologists, so maybe you are quite get different level of ideas about evoked potentials. So what is AEP, auditory evoked potentials? Is an electrical response of the nervous system to an acoustic stimulus. So like when I hear beep, when we do pure tone audiometry, we'll go through the ear, the outer ear, the middle ear, the inner ear, and then your nerves, and then your brain, and then you know that, oh, I hear the beep sound at your brain, and then you press a button as a response to the to what you're hearing. So this is a complete pathway of listening, hearing and listening. But for some cases like very young children or other people like some mentally challenging people, they can't really tell you, oh, I hear that beep sound. So we're testing the when the acoustic stimulus gets into the nervous system, what the changes of the nervous system. We're measuring the electrical response to let us know whether they can hear or they can't hear. Okay, so this is the anatomy of our nervous system, very brief one. So at the end, we got the cochlea, and then the nerve, the spiral ganglion, and the nerve, and then the spine, and then you got different parts of your brainstem, and actually at different parts of the brainstem, the nervous system connect together, of course, and we measure like for short latency, we just measure to the brainstem, and then for the middle latency, we measure up to the subcortical ones, and then for long latency, we measure up to the cortex. So for audiology, we're talking about where's the site of lesion if there's something happen in the whole system so that the patient can't hear well. So which part does site of lesion happen? Which part gets some abnormal problem? Okay, so we break down to short latency, middle latency, and long latency to make sure that we can find where's the site of lesion. Okay, so this part, for the maybe if for someone who is familiar with ABR and ASSR, then we know that we are measuring the brainstem from wave 1 to wave 5. We're checking the ratios and the latency and with the amplitude of the wave 1, 3, 5, so that we know how the brainstem's going when we hear the signal, okay, the stimulus. Okay, for the middle latency, we got the subcortical structures, and then we'll go through the V1 and 0P0, this part, the V1 to NB for the subcortical structures. We also check about the waves. And then for cortex, the long latency is 1P1, N1, P2, and N2. We measure all these, analyzing these figures so that we know what's happening when the sound goes through the auditory pathway. All right. So we talk about just now we talk about the auditory evoked potential, and then we now talk about second part in the Celesta. What we are measuring about is the vestibular myogenic evoked potential. So for this one, we check about like the lowest, like we say the threshold of what we hear. For we find the threshold and we find the morphology of the waves. So maybe like for the same level of loudness of the stimulus, does it different when compared with the notes? But for the EP, the vestibular myogenic evoked potential, we say the VEMP. We in fact checking about the reflex response, not the cortical recording, not to the cortical, the reflex. Um, like after the stimulus gets into your nervous system, and there's some automatic reflex response, not controlled by our brain, not controlled cortically. So it's more subjective, more subjective. In fact, for the auditory evoked potential is also subjective, and the VEMP is subjective. Compare with like the pure tone audiometry, the pediatric pure tone audiometry, and some speech audiometry. They are kind of need more participation of the of your patient. But for this one, the auditory evoked potential, the VEMP, they all very very objective. Okay. So we talk about the CVEM and the OVEM. For CVEM, it evaluates the sacral and the inferior vestibular nerve. For the VEM, both of the VEM, we check about the vestibular nerve, okay? But they're different VEM. The first one is the cervical VEM. We check about the sternocleidomastoid muscle, or we say the SCM for short term. Okay. We check about the SCM. So when we check the CVEM, your patient usually do like this to make sure you can check the SCM, the muscle, okay? It's inhibitory, and we record it ipsilaterally. So you put the stimulus on the left side, and then you measure the left SCM for the response, okay? So it check about the sacral and the inferior vestibular nerve. And then for the OVEM, we're not checking about the SCM, but we check about the ocular, your eyes, okay? In fact, we evaluate the utricle and the superior vestibular nerve, also the vestibular. And then we check the extraocular muscle and the excitatory, and it's record contralaterally. So your stimulus, if you want to check the ovum on the left side, you have to put the stimulus on the right. So this is called contralaterally. Okay. By comparing the right and left responses, we can detect the asymmetries, and then we evaluate the integrity, how the vestibular pathway goes well or not goes well, which part fails. We check about all these with the CVEM and the OVEM working together. We check as a battery of tests, okay? So this is a table of what we are checking. And of course, we talk about the Celesta, the Italian Inventis brand, what the Celesta can do to help all these, okay? We check about, for the portfolio, we check about the ECOG, the electrocochleography, and then the ABR, the EABR. EABR is for the brainstem when we are doing the intra-operation measurement to check the EABR. And then the MLR and the LLR and the CVEM and the OVEM. All of these tests are covered by the Celesta. Okay, So we'll go further to talk about what kind of different models is useful for different setups. So that maybe if you like want to get uh, you want to make a new clinic, say you want to make a new uh, auditory and vestibular center, what kind of the tests you have to include in your center? Okay, let's think about that. And then, so this, I'm not going to go through this very in detail. This kind of may be familiar to our participants. And I just want to highlight that we for different like ECG, the ABR and the EABR, it cover up to the brainstem from the cochlea to the brainstem. And then the MLR, we say the middle latency to the subcortical structures. And the LLR, the late latency, we cover the auditory cortex. And for the VEMP, we check about the vestibular system. So for all the auditory and vestibular parts, we try to cover them. Okay. So just now we talk about different tests, and due to the different structural arrangement, they are put under different modules. Okay, and the license. We have the basic license. So for the cases ABR and EABR, and then we have the AEP Plus license, also the ECOG, the MLR and MLR, and then the VEMP license, and then two-channel enable to speed up the test. And then upgrade, maybe first of all, you want to try, so you get the basic part first, and then later on, you expand your clinic and you include the AEP Plus. And then the uh, our flagship license is the Here Lab ACA license, which is releasing suppose in June this month of 2026. But I think within this year, the third and the fourth quarter, the Here Lab ACA license, the long-awaited license, will be released. Very looking forward to it because it's new to the whole all the audiology field. New, completely new. Not even in other of the our um, friendly other factories. Okay. So we also include the hardware, the Evoked potential system, and then the bow amplifier. Okay, if there is some questions, you just type in the chat box, and I think the our colleague will translate it to me, and then we can reply later. Okay. Okay, so for the AEP, the EP basic license, I don't know if you in your setup, like in a hospital or whatever, like maybe a newborn hearing center, the nursery, will you include the AABR, the automatic ABR for the hearing screening for newborn babies? I had been in a hospital working before in a private hospital in my region, and then every day in the nursery there are like lots of babies. Yeah, every day there are lots of babies, and they stay in the private hospital to like only 2 to 3 days. And then when we try to get some idea about whether the baby can hear or not. Of course, they are not going to give you raise up your hand when you hear subjective things. They can't really respond to the sound. They can't tell. Okay. So we have to do the automatic APR for the hearing screening. And if they pass or fail, they pass, then we go to the normal normal pathway. If they are not passing the ABR, the AABR, the automatic ABR, then we go through the referral pathway. Okay, so for the EP basic license, I think it's good for the hospitals who need the ABR, AABR, and then after some cases they refer, they're not passing for the first ABR in the first few days of their life, like the day 0 to day 3 of the newborn, then like after 1 month, the baby go back for the audiology clinic to do the ABR, to test whether they pass again after maybe clean up the years. So I think the ABR is quite good, yeah. And also the EABR we talk about whether like in a cochlear implant operation, in the operation theater, in the middle of the surgery, we'd like to know after the insertion of the electrode, whether the the patient we insert, so that whether the electrode insert successfully, then we go for the EABR, the checks the impedance. Okay, so if you got some need, like you want to confirm the threshold of patients, newborn patients, or not kind of cooperative patients, like for the patients with, we say, um the, how to say, the organic hearing loss, they're pretending they got hearing loss, then you go for the AABR to confirm the threshold. Okay, so if they got old ABR system and they want to replace a new one to keep up the level of the ABR, then we suggest the EP basic license. Okay, and if you got a center, you want to open a new clinic just for audiology and not vestibular testing, then I think the EP basic is good enough. Okay, for the EP plus with the Evoked, the MLR and the LLR will be more advanced like in a hospital, the ENT department, or in a second level audiology center. We want to know about more any like retrocochlear pathologies. Or we say, you got a patient, um, they have some hearing problem, but they can't really tell, like the pure tone audiometry goes normal, but they still report some hearing problem. Then we go for the retrocochlear tests like the MLR and the LLR. Or maybe for some older kids, not newborn, we suspect them to have auditory neuropathy. The spectrum of the auditory neuropathy. Some they are performing well, just not hearing very well in noisy situations, but they perform well in quiet situations. For the other, on the other side of the spectrum, they pass the pure tone tests, or maybe with some hearing loss in the pure tone tests, but they perform much worse than the pure tone results. Then we go for the EKG and maybe MLR and LLR to check for the auditory neuropathy. And sometimes we use together with the OAE as well. And we measure the cochlear, the EKG, and maybe the cochlear microphonics. We measure a lot of this to check whether it's auditory neuropathy or not. Okay. And maybe suspected acoustic neuroma when in some remote places they're not having the MRI clinic within that remote places, then we can go for the EP plus license. We check with the ABR, the EKG, MR, and LLR check the pathway, the functionality of the auditory system. Okay, so the EP Plus license is helping a lot in managing complex hearing loss cases. Okay, so other than that, we got the CVEM and the OVEM, and this is very obviously for vestibular clinic. Okay, and like you got patients with vestibular problem, or they just report like I got dizziness, I got vertigo, and then if they are not very obvious problem like BPPV or whatever, and then you want to go for the diagnosis of the vestibular, which part of the vestibular system, the site of lesion, and how we can help for the rehabilitation. Then we go for the vestibular diagnostics. Okay. So for these cases, for all of the cases, if we want to reduce the test time, like in a basic clinic, then we'll also suggest a two-channel license so that we can check the right ear and the left ear. We do the data acquisition together on both sides at the same time. So we can have the two-channel license. Okay, for the latest part, the Here Lab ACA license is for aided cortical assessment. I think this is very good for when you're fitting hearing aids, and you can't really tell whether your patient after fitting hearing aid, is there any real benefit after they put on the devices, like for young kids, for some mentally challenged patients, you fit the hearing aids and you still want to check objectively because they can't really tell you whether they can hear or not, then you do the Hear Lab ACA license. Okay. So the typical setting will be the pediatric audiology centers, the hospital managing complex fittings, and some advanced hearing centers, and cochlear implant centers. Okay, and what's the difference is for the previous license like ABR, ASSR, the AEP, and most of these assessment we use some tonal signals, some tonal or synthetic signals. But for Here Lab, we use more speech sounds. So more speech-like stimulus to test we say the verification of the benefits of fitting hearing aids. Okay, so so this is a kind of comparison. Like we use speech-like stimulus other than the artificial stimulus. So that and then the Hear Lab we use free field, we use speakers, so that to check the hearing aid device whether it can help or not. Okay, so the difference between LLR and the ACA is but LLR is a diagnostic tools to check the problem. Okay, and the ACA is fitting verification tool to check, oh, after fitting, the benefits, the real benefits of your patients. Okay. So after we talk about the modular architecture and licensing, and then we talk about some very the system configuration and the standard equipment. Okay, so we got a very lightweight Celesta main unit, just like a laptop, 1.2 kg, and then a bow amplifier, which is also very small, uh, uh, light but uh, strong, power amplifier. Okay, and then we have include with the super old headphone, the DD45, the IP30 insert earphones, the power supply, the USB-C cable, the EABR triggering cables, and adapters, operators, and some consumables, and the Inventis software suites. And then you may also add like the BEMP patient monitor, the bone vibrator, which sometimes we do ABR, we also use the bone vibrator, and then the IP30 insert earphones. Okay, and then we got the power and a lot of at the back, the rear panel of the box. You know the box. This is the main unit, and this is the rear panel, the Celesta rear panel. We got all these insert hubs. Okay, and the requirements of the power and then the PC. I'm not talking about this very in detail. Just want to tell that this part we got the light, and this one is not a decoration. When it goes purple, which means the power is not stable, it's not sufficient for testing accurately. Okay. So we talk about the key strength of the Celesta. First of all, we say the power amplifier is clean and provide stable signal in even in real clinical environments. I don't know whether in the past, when we do the ABR or the ASSR for a long time ago, some other old brands, they require a very clean environment, like magnetically shielded room, like in the audiology room is like in booth, a sound booth, but also electromagnetically shield, because the measurement of the signals is very easily affected by some noises, some electrical, mechanical noises happen around. But now we got much better improved power amplifier, and then we can obtain some clear and stable signal in even in real clinical environments. Of course, in a quiet room, but not that shield, perfectly shield, but still okay because we got very good amplifiers. Okay, and the power amplifier is of course to collect signal from the patients, and then so as to we say analyze by the machine. Okay, and then it's easy to use. I'll tell you later on how it's easy. I really like the latest ideas of how helping the clinicians by the Celesta. Okay, and it's used USB connection through just a single USB cable. I when I was just graduate from the audiology program, like like more than 15 years ago, and for every audiologist, our nightmare is whenever you get into the clinic, you got lots of cables and you have to tidy up every cable every day so as to make it neat and tidy. But now we got just very little cable, like one or two, very easy to handle, very tidy, decent performing nowadays. Yeah, not just like a long time ago, we got every time. When you're performing tests or whatever, you got 5 to 6 sets of cables. Okay. The Celesta is very helpful. It's designed for daily clinical practice and less technical preparation to shorten your technical preparation time, faster setup, and more stable recordings, and easier for you to check out the curves. Okay, so there's a push button on the power amplifier here. Okay, for the left one is to check the impedance, and then you start or pause your test. You stay with the patient and you do not lose the electrodes. Just like checking in the middle of the test, you can check the impedance, and then you pause the test, and you won't like just after in the middle of the test when you want to stop and then to check the impedance, then you have to go back to start the test all over again. It doesn't work like this. After you check the impedance, you can go back to the test and then continue your test so as to save your time. Okay. So, and then you do not have to interrupt the child because there's a button already on the amplifier, the power amplifier. You can focus more on the patient or maybe the parents, not on the keyboard. Okay, so we also have the automatic side switch, one channel mode. Okay, so what this really help is because for some cases in like you're helping a kid, a young kid, to check the maybe the ABR, and then you check the ABR, and then you have to like turn off the light, right? The child is sleeping. You don't want to wake him up or wake her up, and then you have to dim the light, and then you have to put on the channel, uh, the electrodes one by one, and you don't really want to like put the cable again, right? So you don't want to make the child awake. So this is good to have the automatic side switch. So after checking one side, you don't have to put the electrodes again. The power amplifier helps you to switch the electrode automatically. So there's no risk of cable inversion, not mixing up the cable, very safe. You're very confident for the whole test. Okay, you don't have to worry about whether the cable is put in wrongly. And then the automatic vertex short circuit so as to put the setup correctly. And then there's like guidance for the electro connection. Like after you rub the baby, or maybe you rub the child, you don't have to look at the screen, don't have to look at the monitor, okay, of the computer. You just check out the light, the LED light on the Celesta, the power amplifier, so that you already know when you put the electrode, whether the impedance is low enough for the test. Okay? So it's like this. For the active electrode is on the vertex, and one reference, one ground, red for right and blue for left, and then it switch the ground and the reference electrode itself, okay, automatically. So you don't have to swap the cables in the middle of your test. Just focus on the patient, okay? And then later on, you check out the results. Okay, so there's two channel acquisition. So for one channel, we got only 3 electrodes, but for the two channel acquisition setup, we got 5 or 4 electrode with the shared vertex. Okay, this is shared vertex. This is 5 electrodes, but you just have to prepare one time. Then you can reduce the test time by half. Okay, and fewer wiring errors, faster preparation, and better comfort. Okay, just now we talked about not waking the child up. Okay. And also we no longer use the white cable. Much more helping, good enough. Okay, so just now we talked about the LED light screen for correct connection, and then yellow, the impedance is a little bit high, and red is not helping. The test can't be started when it's in red. So when it's recording the test, all this LED turns off. Okay, so reduce the light so that the child is not waking up. Okay, and then blue is for checking the impedance. So here comes after we talk about the hardware, we talk about the software. The we use the Maestro software. If every one of you used the Inventis other equipment before, then I'm sure that you already know Maestro software. You must be heard about that. And Celesta, we like for this license, we got the full version. We got ABR, MLR, LR, ECOG, G, CVEM, and OVEM. And then for each of these module, you can choose your configurations here. Okay. And then some or if you want to set up your new clinic, and you can really use the preset parameters, because all the preset parameters we set based on the scientific literatures. Okay, so you just choose the test, and you maybe take a look and check out a bit about the preset parameters, and then you can go ahead for your clinical test. Okay, and you just select those tests. You don't have to configure yourself a lot. Very easy to use, and the parameters are already very optimized for your clinical practice. And then we use just only the USB-C cable and for both power and the control. So it's reliable and it's simple and decent. Okay, you push the USB-C already help the immediate installation. Okay, so for the positioning of the Celesta, we know that there are lots of other our in the field, the audiology field, we got different brands, right? And then we'll position the Celesta as high customer value, but not very high price. Okay, of course, it's not very low price, but it's high customer value. We say it's high uh uh value and the price ratio. You know, value is different from the price. Sometimes you pay for high price, but maybe you don't really get the very high value. Maybe you just pay for the like if you buy a LV bag for ladies, you buy LV bag, or you buy a Goya bag, or maybe you buy a Chanel bag. Um, Technically it's high price, but it's not very high, very useful bag for you. Maybe it's very look good, look decent, look very gorgeous, but it's not very that useful. The bag is very small bag. Okay, but for some cases, when you buy like say a big bag for your Goya, you can use it a lot. Although it's high price, a little bit high price, but it help you a lot for every daily situation, right? So for Celesta, I'll say is not low price, but not very high price, but it's high customer value. It covers all the, we say the EP, the ABR, the uh, the LLR, the MLR, the ECOG, and the CVEM and the OVEM, and the best one, we got the Here Lab, which is I think is unique over in the audiology field. Okay, so the Celeste you always have a higher customer value, but not that very high price. Okay, so I'm quite confident for the Celeste, and it's stable, and because the Celeste is new, and it already exclude a lot of technical problem for very old machineries. Okay, so we hope if you get used to the Celeste, um, want to try to transform the EP diagnostic to a simple, integrated, easy to use, and patient-centered clinical workflow, but still, of course, very professional one. Okay, and we want to make sure both the clinician and the patient have a best experience with the Celeste, and then we get accurate results, and then we help the patient for the next step, like whether they go for intervention, which kind of intervention, and then maybe some checkup. Yeah, so this is what the Celeste designed for. Okay, so I'll talk about a little bit about the initial setup and connection, and then I'll pass back uh, uh, my sharing to the colleague. Uh, mhm. Okay, so this is the setup. Just now we talk about the setup. Maybe you can also have the bone vibrator if your kid like the newborn baby got the atresia or microtia, and you still want to know whether they can hear with a bone conduction test. Okay, so they can't hear well outside, not able to use the insert phones, just the headphones, and you check that there's a delay of the signal in the ABR, like only the signal only present at like 40 or 50 dB of the stimulus, the level of stimulus, and then you can switch to the bone vibrator. So then you check the ABR. Although it's kind of um kind of a little bit taking more time, you still can help your to accurately diagnose whether the baby really have some um sensory neural hearing loss or just the conductive hearing loss due to the atresia or microtia. Okay, so and then you got a power amplifier, and then you got a main unit, and then the transducers, the VEMP monitor, and bone vibrator if needed. And of course, not needed for every time if you got a kid with finally normal hearing. Um, yeah. And then the channel one, the channel two, the on the power amplifier, and the 4 to 5 electrodes. Yeah, this is the guide of how to check out the LED lights. Okay. And some troubleshoot if you see the purple blinking light, which talk about the battery, the power is not sufficient. And in the past, we got remember this impedance place. We check the impedance calibration, and after check the calibration, and then you check with your real patient the impedance. Okay. So this is the recommended values of the impedance. Yeah, and this is the demo pictures. And then for this part, I think we talked about that a little bit before. It's like you rub the skin and then you place the electrodes to ensure with the gel, the conduction gel, so to ensure good electrode contact. And then you run the impedance test before you start the recording. Yeah, you can take a look at the Maestro, the software, or you can just take a at the power amplifier. Okay. And then of course you put the stimulus like through the inside phone or whatever, and or the headphones or the bone conduction, or maybe later on the free field. And then recommend values will be this one for the impedance. If the impedance is higher than 5K ohm, then we recommend you to rub the skin again and check the electrode contact. Okay. So for the stimulus available in the Celesta, we use click, tone burst, the chirp, and the chirp family, which is quite exclusive in the Maestro. And different kind of stimulus will be used in different tests in different setup. Okay, and then remember the Maestro software, it already designed the parameters. So you don't have to like check out your books, check out your study materials every time for the stimulus. You just choose those preset parameters, then it will already help because it's follow the scientific literatures. And then this is some spare clinical overview. If you have time, then you can check out the like what ABR and then BEMPs are, and they're different kind of setup. Okay. So So for the positioning, we talk about the why Celesta is very competitive. It's because we have here lab is unique over the audiology field, and it really helped to like evolution of how to help very difficult cases of fitting hearing aids. Okay, and or not even fitting hearing aids for babies. You want to know the real time when they are like they don't even need any cables on the baby so as to check their hearing. Then you can use the Celesta. Just a few cables, not even wearing the headphones, okay? So the future modules will be ASSR, and I think for the other point for fitting hearing aids is we want to know frequency specific information. So after okay, we got a baby, and we know ABR they got hearing problem. Okay, and then we have to fit hearing aids for the kid so that to help their speech and listening development. And then but when we fit hearing aid, we need frequency specific threshold information. So later on, the Celesta will have the ASSR module as well. Okay, so here comes some questions from the field to check out. Some we say the troubleshoot. Maybe if you have time, you can take a look at that. I prepare a lot for today's presentation, but I don't think I can finish it within 1 hour. Yeah, of course, I share the presentation later on so that the colleague will translate it in English, and then you will have the full version of my presentation. And thanks for attending the presentation today.
Oke,
Oke, selanjutnya kita akan memasuki sesi tanya jawab yang akan berlangsung selama kurang lebih 20 menit. Bagi peserta yang memiliki pertanyaan, baik terkait materi yang telah disampaikan, dipersilakan untuk menyampaikan dengan mengaktifkan fitur raise hand. Dan sebagai catatan untuk seluruh audiens agar dapat menyampaikan pertanyaan menggunakan bahasa yang dimengerti oleh narasumber, yakni bahasa Inggris. Dan mohon dibantu untuk mengirimkan pertanyaan melalui chat Zoom pula agar dapat direview berulang oleh narasumber. Boleh kepada Dr. Ronald Pascal Kalejan.
Doctor, we have received a question from the participants. Please allow me to read the question. Does the VEMP examination can be done in office setting with the ambient noises or must be done in soundproof chamber? The floor is yours to answer the question, Doctor.
Baik, sambil menunggu pertanyaan dari peserta, kami izin mengajukan pertanyaan terlebih dahulu kepada Dr. Annabelle, nanti akan ditranslate dengan rekan saya menggunakan bahasa Inggris. Pertanyaan pertama, mengingat aksesibilitas layanan audiologi canggih belum merata di seluruh wilayah, bagaimana peran praktisi klinis dalam memastikan bahwa prosedur pemeriksaan seperti VEMP atau AEP ini tidak hanya menjadi prosedur eksklusif di kota besar, dan langkah apa yang bisa diambil agar pasien di daerah terpencil tetap mendapatkan diagnosis yang akurat serta tepat waktu.
Question 1. Given that access to advanced audiology services is not yet evenly distributed across all regions, how can clinical practitioners ensure that examination procedures like VEMP or AEP do not become exclusive procedures limited to major cities? And what steps can be taken to ensure that patients in remote areas still receive accurate and timely diagnosis?
So, doctor, while waiting for question for the participants, please allow us to ask question first.
Okay, can you hear me? Hello? Can you hear me?
Yeah, I can hear you, doctor.
We can hear you.
Okay. So, I think just now we talk about remember we talked about we have to prepare the patient for the tests, right? And then we have to like aspiration on the skin and then put the electrodes, and then we need a chamber, a quiet, soundproof chamber, all these. And I think this is quite factual to have the patient to attend in the audiology vestibular clinic in person. So I don't really think it can be possible for telehealth for all the AEP and VEMP tests. I think we can't ensure patients to remote area to get this accurate and timely diagnosis if they don't come in person. Or if you have a clinic in a remote places, still you have to like if you put your device in that remote places so that they can travel to your clinic, or maybe they have to go to your clinic in the middle, in the center of the city, so that they can get the audiology and vestibular tests. So yeah, I understand the need because in your country is you got very a lot of different regions. But still, because this test, we need to control the environment and it need professional skills. It need lots of different direct contact with the patient. So I don't think it really can help with the telehealth.
Terima kasih dokter atas explanation yang sudah disampaikan.
For the second question, what's the advantage or benefit using the Hear Lab? Other than for the like patient using hearing aids, for classic behavioral threshold like the sound field aided tests in children, like or maybe in adults, for cases in adults, they generally, after putting a hearing aids, you ask the patient to like put up your hand when you hear boo boo boo, and then they usually can perform well, like reliable responses. But if you got a kid, and for just 3 to 5 years old, and maybe they perform a little bit about the behavioral threshold, like they can play audiometry, and but they may lose their attention for a very short while. Maybe they have to come back the next time, 1 year at a time, or like still reliable, but you have to extend your test time from like 1 session to 2 sessions a year, and you have to repeat like every half a year or every 1 a year to make sure everything goes well. So maybe you can think about go with the Here Lab ACA, so that even they're like moving around, playing a game, not um, engaged to what you're doing, and maybe no need for the your assistant or maybe the parents to help to assist the child. Still, you can get the ACA response, the HEALAB ACA response. So this is more easier for the clinician to get some objective results from the kids, from those challenged to be tested patients. So I think the advantage of Here Lab ACA is like that. You don't have to worry about, oh, today your patient got sick, so they can't focus well. The young child cannot focus well because they got sick, or maybe after maybe they get to the kindergarten in the morning, and then in the afternoon they got tired, they got sleepy, and they got bad tempered, and they have to skip this session of tests. Still, you can use the Here Lab ACA. Okay. In case of hearing or balance disorders. Topic. I don't really know for the cases. Your question about in cases of hearing or balance disorders where symptoms are often dismissed by general public as minor health issue, how effective are AEP and VEMP examinations in detecting problems early to prevent permanent damage? And what is the most appropriate education strategy? So you're asking two questions here indeed, not just one. And appropriate education strategy to convince the public of importance for these tests before their condition worsen. So let me answer the first question first. How effective in detecting the problem? I think of course it's very effective for detecting problems. And you mean for prevent permanent damage? I think if they got some vestibular problem, and it's kind of different if they got whether it's a short term or permanent problem. I think it's better for the doctor to tell them because it needs some very professional medical backgrounds to answer this question. And it's different from cases to cases, so I don't think we can like shortcut to answer this question. Okay, so this is very down deep and different for case to case basis. Okay, but you mean how effective AEP and VEMP examination? What we have to do is we ensure the AEP and the VEMP examinations are accurate and easy to perform. So when after the patient first come to your clinic, you can provide them very timely help, like perform the tests in a short time so that they don't have to wait for a long time to queue up for the test and then queue up back for seeing the doctor. I think this can be controlled. But if like for very general to promote uh, uh, and prevent permanent damage, I think it's kind of very case by case basis and not really related to the AEP and the VEMP examination. Okay, and then for what is the most appropriate education strategy? Um, I think for the public, the education strategy is not only in your country. I think in most of the countries, patients like like in my country, we got some very a lot of Chinese patients. They not only think about the um, Western medical uh, uh, pathway, they also think about like um, Chinese medicine or other very uh, not that not what we are checking about the medical with the um, this kind of medical and pharmaceutical field. So I think the appropriate education strategy is that they really have to know that um, they have to take the responsibility for themselves. Yeah, if they got dizziness or vertigo problem, maybe uh, they don't can't really just seek for only one opinion from some like uh, uh mm, very like first level like but just buying medicine in the pharmacies. Yeah, they better go for some thorough testings. Mm. Hmm.
Terima kasih atas penjelasan singkatnya, Dokter. Untuk tadi kami sudah menerima pertanyaan dari Dokter Fiona Widiasari dan sudah dijawab pula oleh Dokter Annabelle. Apakah Dokter Fiona dapat memahami dan apakah sudah clear, Dokter?
Hello, Dr. Annabelle. I'm Fiona from Palembang, Indonesia. Thank you for answering my first question.
Um,
In the chat box.
I don't think we can do them together if because you see the setup. Mm, the OVAM we and the CVAM, the CVAM, we look into the let me share the screen. For the CVAM is here the secondly we measure the sternocleidomastoid muscle before, okay, and then for the OVAM we measure the ocular, the eyes. We put the electrode on the face so as to check out the eyes. So we are measuring totally different things. We better measure the sometimes we measure the CVAM and sometimes we measure the OVAM. It depends on the initial findings by the physician so as to check maybe they suspect like if they suspect for the inferior vestibular nerve to have problem, then they check order the CVAM, okay? But if they suspect the superior vestibular nerve problem, then they order for the OVAM, okay? So sometimes, of course, we perform all the tests in a test battery, but because of like the patients, if they go through the whole tests, like for the CVAM, they have to hold the position like this, hold the position like this. Not a very comfortable, not a very comfortable position, of course. So maybe sometimes we only do the OVAM if they suspect to have the superior vestibular nerve, the problem.
Oke, dari Dokter Fiona sudah jelas. Terima kasih atas pertanyaan dan penjelasannya, Dokter Annabelle.
Okay,
Thank you,
you're
Doctor,
welcome.
for the explanation. Very insightful for us and also the audience.
Oke, sebelum itu, apakah mungkin ada pertanyaan tambahan? Are there any more question? Baik, sepertinya untuk pertanyaan sudah cukup.
So, Doctor, here's a brief recap of the discussion so far. The key messages highlighted by Dr. Annabelle include clinical foundation of evoked potential, modular architecture, analyzing structure, and system configuration and standard equipment, etc.
Oke, mungkin ini adalah rangkuman singkat dari kami mengenai pembahasan yang telah disampaikan oleh Dr. Annabelle yang menekankan beberapa poin, yakni Celesta diposisikan sebagai sistem evoked potential yang praktis, modular, dan user-friendly, dengan fokus utama pada kemudahan penggunaan, efisiensi alur kerja klinis, serta pengurangan kompleksitas operasional. Dan produk ini sangat sesuai untuk fasilitas kesehatan yang membutuhkan solusi IP modern dengan proses instalasi sederhana, pengoperasian mudah, dan kemampuan pengembangan sistem sesuai kebutuhan di masa depan. Baik, untuk Dr. Annabelle, terima kasih untuk penjelasan yang telah diberikan. Mohon maaf karena keterbatasan waktu untuk pertanyaan yang belum sempat terjawab. Akan kami tindak lanjut dan sampaikan informasinya melalui pesan WhatsApp.
Dinyalakan terlebih dahulu kameranya. And Dr. Annabelle, we would also like to invite you to join us for a documentation session. Furthermore, we would like to inform you that the webinar documentation will be published on Nusa Medika Indonesia Instagram account, and we will take your account as a form of appreciation for your contribution.
Baik, untuk seluruh peserta, nantinya dokumentasi webinar juga akan kami unggah melalui Instagram Nusa Medika Indonesia. Kami mohon izin untuk menandai akun dokter pada unggahan tersebut sebagai bentuk apresiasi atas kontribusi dan partisipasinya dalam webinar hari ini, yang pastinya akan berguna untuk dokter dalam meningkatkan exposure, professional branding, dan memperluas jangkauan edukasi yang telah dibagikan. Kami akan sangat senang apabila dokter berkenan untuk turut membagikan atau melakukan repost setelah unggahan tersebut dipublikasikan. Oleh karena itu, mohon berikan senyum dan pose terbaiknya karena tim dokumentasi akan segera melakukan penangkapan layar untuk dokumentasi webinar hari ini. Ya.
Oke, dokter. Baik, Bapak Ibu dokter bisa dinyalakan kembali untuk kameranya karena sesi dokumentasi akan dimulai segera.
Please turn on the camera. Alright, kita akan mengambil gambar. 3, 2, 1, smile. Once more again, with Nusa Medika logos, like this. This is Nusa Medika logo, Dr. Annabelle. Okay, we will capture 3, 2, 1. Baik, terima kasih banyak kepada seluruh audiens dan Dr. Annabelle. Thank you very much.
All right, the documentation session has been completed. Once again, thank you, Dr. Annabelle, for your valuable time and wonderful presentation for today. We truly appreciate your presence and contribution to this webinar session. If you need to leave the meeting, please feel free to do so. And to all participants, let us show our appreciation to Dr. Annabelle by sending a round of applause through the clap emoji.
Baik, kepada seluruh peserta, mari kita tunjukkan apresiasi kita kepada Dr. Annabelle melalui emoji tepuk tangan. Baik, dokter dan audiens sekalian, selanjutnya kita akan masuk ke sesi kuis yang akan berlangsung selama kurang lebih 5 menit. Kami akan membagikan Google Form kuis melalui chat Zoom. Dokter dipersilakan mengisi form tersebut sebagai bagian dari penilaian door prize webinar hari ini. Pada Google Form tersebut terdapat 5 pertanyaan kuis, konfirmasi minat klaim kode referral, voucher diskon, serta kesan dan pesan dokter pada saat webinar. Bagian konfirmasi minat klaim kode referral disediakan bagi dokter yang berencana melakukan klaim kode referral sebesar 10% untuk mengajukan kebutuhan pengadaan alatnya ke rumah sakit. Dengan begitu, sehingga tim sales dapat memprioritaskan tindak lanjut kepada dokter tersebut. Dengan begitu, kami persilakan seluruh dokter untuk mengisi Google Form quiz yang telah dibagikan melalui chat Zoom. Baik, kepada dokter dan audiens sekalian, apabila telah selesai mengisi kuis, mohon diinformasikan melalui emoticon jempol seperti ini.
Kami informasikan bahwa waktu pengisian kuis telah selesai, dan seluruh jawaban yang masuk akan kami proses sebagai bagian dari penilaian door prize webinar hari ini. Pemenang door prize akan dikontak lebih lanjut oleh tim melalui WhatsApp setelah acara selesai. Kami sangat mengapresiasi waktu dan antusiasme dokter dalam mengikuti sesi ini. Pemenang door prize 1 unit Remi Pro akan dipilih dari peserta yang mengisi Google Form quiz.
Baik, pemenang door prize akan dikontak lebih lanjut oleh tim melalui WhatsApp setelah acara selesai. Selain itu, harap diperhatikan, khusus peserta webinar juga tersedia promo spesial, yakni yang pertama, diskon 5% untuk pembelian pribadi seluruh produk kecuali produk Inventis PT Nusa Medika Indonesia. Yang kedua, diskon 10% untuk pembelian produk pribadi, produk Inventis PT Nusa Medika Indonesia. Yang ketiga, referral fee atau support fee sebesar 10%, dan nilai pembelian alat bagi dokter atau user yang mereferensikan atau mengajukan kebutuhan pengadaan alat ke rumah sakit.
Selanjutnya, mohon kesediaan dokter untuk mengisi formulir absensi kehadiran. Silakan klik tautan yang telah kami bagikan di kolom chat Zoom. Berikut tautan untuk absensi kehadiran sudah kami cantumkan, dokter. Pengisian formulir ini sangat penting sebagai syarat verifikasi klaim voucher diskon, referral fee, door prize, dan juga penerbitan e-sertifikat bagi seluruh peserta webinar.
Baik dokter sekalian, tidak terasa di penghujung acara, mohon izin mari kita tutup webinar hari ini dengan pantun. Pergi ke pasar, membeli ketupat.
Tidak lupa membeli jamu.
Terima kasih atas waktu yang diberikan dokter dengan hangat.
Semoga ilmu hari ini bermanfaat untuk praktek selalu.
Saya Marcella.
Dan saya Cynthia. Pamit undur diri.
Bagi dokter yang telah mengikuti seluruh rangkaian acara hari ini, dipersilakan untuk meninggalkan Zoom meeting.
Selamat sore dan salam sehat untuk kita semua.